This is an outgrowth from the time I started practice and becoming Chief of Newborn Services at Kapiolani and then Chief of Staff. I recognize that the child with special health care needs, young parents, don't have a voice because they're working parents, they're young parents, babies and children don't vote, unlike the senior citizens. Nobody advocates for them. And as such, I felt a primary care doctor in practice is the advocate for the individual one-to-one in terms of services needed. But the only way to accomplish this was to have accessibility, community-based, be available 24 hours, 7 continuously, but mainly to develop trust in terms of family partnership. Family partnership, family-centered care is a crux of how we deal continuously on an ongoing fashion, especially in pediatrics, because we see them on well child care certain periods in first few years of life, and you develop a relationship, questions and answers, beginning to trust or relate to problems that are real, that are not just disease, physical, but mental, emotional, social, that you'd like to support. That's where the context, the family and child and the community comes in. That's where you begin to advocate for coordinated care and understanding the problems of cultural variation. Filipinos, Chinese, Japanese, Samoans, Polynesians in terms of, and now Vietnamese, and all the different cultural differences of accepting a birth defect, or accepting a disease, or accepting mental health problems, how to deal with this. And the basis for the medical home would be a doctor with some compassion. And I must say, pediatricians, normally the majority have compassion. So that this all ties in with the accessible, family-centered, coordinated care that's comprehensive, coordinated, culturally effective, and compassionate.